Lamotrigine is approved as mood stabilizer to prevent recurrence of both mania and depression. Interestingly, the FDA has not approved its use for bipolar depression, and yet some experts believe that lamotrigine is effective for the same. With growing concern about antidepressants inducing mania, causing mood instability, and increasing suicidality in bipolar disorders, lamotrigine has largely replaced antidepressants as first-line recommendations in most treatment guidelines for bipolar depression. Has some overlapping mechanistic actions with carbamazepine, namely binding to open channel conformations of voltage-sensitive sodium channels, but is not approved for bipolar mania as actions are not potent enough at sodium channels, or perhaps a long titration period is required when starting. It is generally well tolerated for an anticonvulsant except for its propensity to cause rashes, including, though rarely, the life-threatening Stevens-Johnson syndrome or toxic epidermal necrolysis. This can be minimized by very slow up titration of drug during initiation of therapy, avoiding or managing drug interactions such as those with valproate that raise lamotrigine levels, and by understanding how to identify and manage serious rashes and to distinguish them from benign rashes. Lamotrigine also reduces the release of excitatory neurotransmitter glutamate, especially if excessive during bipolar depression. This action is unique to lamotrigine.